welcome to my channel. Now we are going to talk about diffuse large B-cell lymphoma, that is Dlbl. So diffuse large B-cell lymphoma is the most common non-Hodgkin's lymphoma in India or the world, and it is a mature B-cell type of lymphoma, and among all non-Hodgkin's lymphoma it has got the worst prognosis. So worst prognosis lymphoma is diffuse large B-cell lymphoma, and it is usually seen in older patient more than 60 years of age, but it can be seen in children as well. So it is seen in 20% cases of children, and male are more commonly affected than females. So 80% of diffuse large B-cell lymphoma are B-cell type and 20% is T-cell type. Dlbl has got three subtypes: immunoblastic non-Hodgkin's lymphoma, primary CNS lymphoma, and primary effusion lymphoma. So most common type of non-Hodgkin's lymphoma in HIV or AIDS is immunoblastic non-Hodgkin's lymphoma. So it is seen in 60% of the cases. And primary CNS lymphoma, you will see this primary CNS lymphoma in HIV or AIDS patient, and it mainly involves the brain, and it is associated with Epstein-Barr virus infection. Now let's talk about primary effusion lymphoma. Primary effusion lymphoma is seen in elderly patient more than 50 years of age, and they present with recurrent pleural effusion or any cavitary lesion. So it occurs in age group more than 50 years, and it presents with recurrent pleural effusion. Now we're talking about the markers. Let's talk about immunophenotyping. So CD markers are CD19 and CD20. So CD19 is positive and CD20 is positive. We see other variable expressed marker, that is CD10 and BCL6, but these markers can be positive or can be negative sometimes, and there will be increase in MYC gene and BCL2 gene. There will be overexpression of MYC gene and BCL2 genes. So this will give an aggressive form. Now what are the cytogenetic changes? So there are three cytogenetic changes. One is BCL6 translocation. So BCL6 is a germinal center origin, so it originates from the germinal center, and BCL6 translocation from 14 to 18, and MYC translocation. So these three are cytogenetic changes is seen in Dlbl. So when you do the lymph node biopsy, lymphoid cells are seen which are twice the size of normal lymphocytes. So the lymphoid cells are twice the size, so they are larger in size than the normal lymphocytes, with enlarged nuclei and prominent nucleoli. Now let's revise it once again. So diffuse large B-cell lymphoma is more common in India, and it's a mature B-cell type with worst prognosis, mainly seen in old age patient more than 60 years of age, and males are more affected than females. So 80% are B-cell type and 20% is T-cell type. It has three subtypes: immunoblastic non-Hodgkin's lymphoma, primary CNS lymphoma, and primary effusion lymphoma. So most common type of non-Hodgkin's lymphoma in HIV/AIDS is immunoblastic non-Hodgkin's lymphoma. So primary CNS lymphoma is seen in HIV or AIDS patient. It involves mainly the brain and is associated with Epstein-Barr virus infection. And primary effusion lymphoma is seen in elderly more than 50 years of age and presents with recurrent pleural effusion. So markers CD19 and CD20 both are positive. So these are the variable markers, where CD10 and BCL6 is a variable marker which may or may not be positive. So there is increase in MYC and BCL2 expression, which gives an aggressive form. There are three cytogenetic changes: BCL6 translocation, T translocation 14 to 18, and MYC translocation. On lymph node biopsy, you see lymphoid cells which are larger in size. They are twice the size of normal lymphocytes. They have enlarged nuclei and prominent nucleoli. So this was the overview of diffuse large B-cell lymphoma. And if you like the video, please do like and subscribe the channel. I will see you in the next video.